Hello, my name is Joy Ajiboye. I'll be doing a video on wound care. So here with me, I have my equipment here with me. I have my biohazard bag. I have my wound care tray. I have my Starling irrigation bottle. I have my glove here with me, my sterile water, my 4x4 gas, my tape, my sterile cotton here with me. So the next thing I'm going to be doing is I'll be going to my patient room. Hello, my name is Joy Ajiboye. I'll be performing a wound care on you. Is that okay? He said it's okay. Can you identify yourself by telling me your name and your date of birth? So, okay, you say your name is Mr. Smith, May 18, 1980. So, which is okay with what I have on my record here with me. So, the next thing I'm going to be doing is I will be asking him some few questions. Do you have any allergy? Do you or any tape allergy? He said he has no any allergy. Do you have any pain? Okay, you say you don't have pain. If my patient was having pain, I will advocate for medication as prescribed by my provider. But since he has no pain, no medication. So the next thing I'm going to be doing is I will wash my hands and I will be putting on my gloves. So I've washed my hands and I've put on my glove. So the next thing I'm going to be doing is um so the next thing I'm going to be doing is I will raise beside the bed to a walking eye position. I will lower the side weight down, and also I will provide privacy. So I'll be explaining the procedure to my patient, what I'm about to do. So Mr. Smith, what I'm about to do is I'm about to change your wound, change your whole dressing, irrigate the wound, clean it, and put on a new dressing. Is that okay by you? He said it's okay. So the next thing I'm going to be doing is I will take the dressing, the whole wound, and also I will check which is clean. So since it's clean, I will gently fold it and put it in the trash bag. So if it's not clean, I'll put it in the biohazard bag. But since it's clean, I will just put it in the trash bag. So the next thing I'm going to be doing is I'll take off the dry gas. I'll take off the dry gas. I'll check how many was used, which is one. Same thing I'll be using. You do same in the other one. How many was used, which is one. I'll put it in the biohazard bag. Then I will check. I'll get the wet gas and also check how many was used, which is one. Also, I will check how many was used for the wet gas is one. So what I'll be doing is I'll fold it with my glove. I'll roll it and take it up with my glove. I'll take it up with my glove. I'll put it in the biohazard bag. I'll perform hand hygiene, and also I'll be putting on a clean glove. So the wound looks good. So I've checked the wound, making sure to know if the wound looks good or not. The wound looks good. So the next thing I'm going to be doing is I'll position my patient in such a way that the wound will drain out. So I'll position my patient. I'll be using this tray. I'll position my patient in such a way that the wound is going to drain out. So here with me, I have my wound care tray. I'll put this aside. I'll be using this. So I'll position my patient in such a way that um I've positioned my patient in such a way that the wound will drain out. So the next thing I'm going to be doing is I will get I will use I will use the sterile water. I'll open it, put some sorry, before putting it in this is my tape. I'll take this take off everything that is in the tray. Everything that is in the wound tray, I'll take it out. So there are there are some gas there. So I'll put distilled water in it, and also put here. So I'll position my patient in such a way that that is good for him, in such a way that the wound is not going to will not drain out. So I will start from the less contamination to the most contamination. So I will assume this is my less contamination to the most contamination, and also less contamination to the most contaminated, less contaminated to the most contaminated, less contaminated to the most contaminated. So in doing that, you don't have to do it in zigzag way. You go from here to here, then you come back from here to here. So this is what I'm about to do now. So less contaminated to the most contaminated, you come back. Less contaminated to the most contaminated, do same here. You come back. Less contaminated to the most contaminated. So and in the process of doing that, make sure that it doesn't touch the skin. So as soon as I'm done with that, the reason why I did from the less contaminated to the most contaminated is because when rinsing it out, I don't want the most contaminated to contaminate the least contaminated. So that was why I decided to do it that way. So make sure that they won't drain out, which is okay. So I'll position my patient, put this aside. So I'll be using my tape. I'll be using my measuring tape. I will measure the length. In doing that, make sure it doesn't touch the skin. I'll measure the length, and also I'll measure the weight. I will get the starry cutting to measure the depth by going um, deeper to the deepest point and put it in the biohazard bag. So in putting it in the biohazard bag. So the next thing I'm going to be doing is I will get the gas, squeeze it. Make sure you get the length of the wound. Put it gently. Do not allow it to touch the skin. So I'll be using the sterile cutting to adjust it. Put it in the trash, in the biohazard bag. So I will get my 4x4 gas. So I'm taking this away. So you start from the shortest edge to the longest edge. Tape it. You can always put your tape here if you don't want to like put it this way, the way I'm doing mine. You can always put it outside and take it if that will be easier for you. I think this is more easier for me. I started from the shortest edge to the long edge. So the next thing I'm going to be doing is I'll take off my glove, put it in the trash, perform hand hygiene, raise the side way up, lower the bed to a comfortable position, and uncover the privacy. You put a call bell at the reach of the patient. He can call you anytime you want to, and also you document the length, the width, the depth, the consistency of the wound, and also the color, if it is red or pink, and the amount of drainage that was taken out from the wound. You also document that, and also you can always come back to check your patient to know how he's doing. Thank you.